When I first started doing locums 12 years ago, man, those numbers, the double digits now. Yeah, we getting up there. You getting up there, yo.
Why does it always come to me?
Because men age like a fine wine, you know what I'm saying?
He said they age like fine wine. Let's just talk about the fact that he lost all his hair.
Okay, thank you.
I am willing to say that I actually look better without hair than I did with hair.
You know what? I will not disagree because I've seen the pictures.
Yes.
Up until
Tiara's
a certain
fired,
point,
guys.
y'all age. Okay. Well, good luck.
Exactly.
Up until a certain point, though, men do age fairly well. And then right around 50-ish, it's like, doop, fall right off the cliff.
No.
I don't know, because have you seen what 50 be looking like now for women?
Hurry up.
I'm not going to step into that.
Folks, your exciting new medical career, it's just been hit with a serious illness or injury that stops you from earning a paycheck just when you need it most. Check out what Jamie Fleischner of Set for Life Insurance said back on episode 176 about having disability insurance early in your career.
The real reason to get it early on is really twofold. One is to protect your insurability. So if you are healthy and you can obtain the coverage, you also pre-approve yourself to be able to buy more in the future. So down the road, as your income does increase, you don't have to answer additional medical questions. All you have to do is show that your income is increased and you can buy more benefits at that time. No medical questions asked.
Protect your income, secure your future. Check out setforlifeinsurance.com.
Yo, what's up, everybody? This is Dr. Nee. I'm joined by Dr. Renee and the rest of the Docs Outside the Box team, my superheroes. I got Audrey all the way from Kenya, and I got Kiara all the way from North Kakalaka. Welcome to another episode of Docs Outside the Box, y'all.
Yeah.
Let's jump into this because I am tired. I'm coming in off of night shift. I'm purely running on steam. And the whole night, Renee, while I'm doing my notes, I'm listening to Kendrick Lamar's GNX album because it be like that. And sometimes when you are tired and you need some fuel, that album gets me through the night. I love that album. So
Excellent. Well, let's hurry up because I got a meeting with a pre-med.
Oh, my goodness. Okay.
Yes.
All right. So, Kiara, what is the question that we have for today?
All right, so this one is about health insurance and retirement plans on locums.
Ooh.
And it's
Who's it from?
froze on me.
It's very apropos, too.
It froze on me. Hold on.
Very apropos. This is the beginning of the year.
It's from Josephine.
Yay.
And she said, a friend of mine just shared with me one of your videos where you talk about how awesome it's been doing locums. I just love that. I'm a second-year medical student, and have always wanted to go into OB. I'm all about the work-life balance, and I think locums would give an opportunity for just that. I just have one question, though. How do you navigate the health insurance and retirement plan component? I'm not sure if locums provides that.
Yo, I'll be really honest.
Josephine, for the
I'll
question.
be really honest. Josephine, thank you for submitting that. But I've been really interested in the comments that we've been getting about locums from medical students. Have y'all noticed that? Like, we've gotten questions from people who, like, they still have several years before they have to even start worrying about locums, right? Because for the medical students, if you're wondering, like, locums is not until you finish residency and you are working on your own, right? Once you start working on your own, then you start considering locums, right? There's some small caveats, but just for the sake of this convo, it's when you finish. And I think what you're starting to see is a lot of people are starting to realize, hey, like, this is a lifestyle that I want to think about, or this is a lifestyle that interests me, despite all the noise that I got to worry about with studying, with taking boards, with getting through rotations. This is just a lifestyle that I want. I have on my service right now, I have a medical student who's applying for medical school, applying for residency right now. He's doing his interviews right now. He wants to go into trauma critical care. And I was telling him, I was like, I really like my job because I like the operations that I do. I like the patient that I get to see. But the way in which I jump in and jump out, the lifestyle, like, you can't beat that. And I think you don't really see that in many other specialties in the surgical fields. Whereas trauma critical care, it's very much like lifestyle oriented. And it's really hard when you're in, like, you're very focused and then you can step out. And he said, yeah, like, I really enjoy that. I'm very interested in chatting with you about that in the future. I was like, okay, but I'm like,
Yeah.
that's another thing. That's like a fourth year medical student who's interested in that. So
Yeah.
good question. Good question. And it's very apropos right now, right? So we're recording this in January. We just re-upped our 1 year subscription for health insurance in the state of New Jersey. So we get our health insurance through healthcare.gov, or we get it through quote
The
unquote
marketplace.
Obamacare, the marketplace, the Affordable Care Act. And we've been getting our insurance through there since 2017. So we go online and we fill in some information. It's really quick. You just go to healthcare.gov. Alfred, if you can put that in there. And when we go to healthcare.gov, you go specifically to the state that you live in. And you, in essence, just start shopping for the different type of healthcare insurance that you need. And it's based off of how many people you need to get covered. So for us, our family, I have to find coverage for Renee, me, as well as 2 kids. And you just get to shop. You literally get to look at like a bronze plan. You get to look at a silver plan, and you get to look at a gold plan. And you get to basically like just compare and contrast them between all the different companies that are selling health insurance in the state of New Jersey. You get to look at that through the website. Sometimes it could be a little bit overwhelming, but yeah, that's how we do it. But when you do locums, when you work as an independent contractor, your health insurance is not covered. Your retirement plan, like there is no such thing as that. You work and you get paid, and then that's it. And then you have to take that monies and purchase those benefits that you would normally get if you were employed.
Right.
How'd I
And
do,
then
Renee? Did I explain it right?
yeah, no, that's good. That's good.
Yeah.
And then that money is actually now, that money is now tax deductible, correct?
Yes, it is. Yeah, because that's the cost of doing
Right.
business. The cost
Right.
of you doing business as an independent contractor is not just you being at work, going to work, but it's also running your work, which is you need health insurance. So that's tax
Right.
deductible. You need a cell phone plan,
So,
stuff like that.
right. So if you're a med student and you're not quite business savvy yet, you don't quite understand what that means. When people say tax deductible, you know that it sounds good, but you don't quite know exactly what it means. So as a locums, right, when you work as locums, when you get your check, right, from whatever hospital that you're going to be working at, you don't have taxes taken out of that check, right? So if you've worked before, you know that FICA comes after you. You got to
Who's
make
FICA?
contributions. Exactly. You got to make contributions to the government, Medicare, Medicaid, all that kind of stuff. So you know that you are going to have taxes taken out. Well, when you're locums, you're not employed by anybody but yourself, right? You yourself are the business. So you contract out and the hospital cuts you a check with no taxes taken out. Well, even though taxes aren't taken out, that means later on that you do have to pay taxes. So the question is, well, what are you going to pay taxes on? You don't have to pay taxes on that whole check. What you pay taxes on is anything that you didn't use for running the business. So if you buy health insurance is the cost of you doing business. So you're going to take a portion of that money and pay for your health insurance. So when you pay for your health insurance, that money, because it hasn't had tax taken out of it yet, that money is tax free and you pay your health insurance with tax free money. So that's what that means. And, we're going to talk about this so many times over the course of the podcast. So if you didn't get it today, don't worry. Just keep listening to our episodes. You will eventually get it.
Remember we covered this about several months ago. There was an article by that urologist who says he works half of the year and makes a significant amount of money. He makes like
Yes.
400K as a
Yes.
urologist being a locums doc. And like the number is astounding considering the amount of time that he's putting in, right? That's great. But if you go to the bottom of his article, if you pay attention to what he says, in there it says, just so you know, me working this way is cheaper for the hospital, actually.
Mm-hmm.
So one thing that a lot of people don't know is that when you're employed, you actually cost the hospital more money
Mm-hmm.
versus when you work in a locums independent contracting fashion.
Right.
Do you want to explain why, Renee, or you want me to? But I know that's one thing
Yeah,
that
go ahead.
that's one thing that a lot of people who I think are trying to negotiate with the hospital, they get talked out of by the hospital. They're like, oh, why
Yeah.
don't you just come on as an employee? You know,
It's
let's say
cheaper
you're
for
a
us,
doctor.
blah, blah, blah.
Let's say you're a
Mm-hmm.
doctor. Yeah, they always say that. Like, let's say you're a
Yeah.
doctor and you're trying to work at a hospital. Like, they're always going to try to get you as an employee, right? But actually, you are costing the hospital less. And
As an independent contractor. Yeah.
outside of the people who usually are trying to convince you, which could be like a chief medical officer or maybe a department head, like a department chairperson who doesn't
Mm-hmm.
understand the numbers and doesn't understand human resources. And that's no shade, but they just don't understand that part. You actually are cheaper when you work as an independent contractor. And the reason why is when you get your salary, like your salary as an employee is not just the salary it costs to pay you to work, but it also includes you needing to get disability insurance, you needing to get health insurance. Like the hospital has to pay a portion of your health insurance, right? So you have to pay a portion of your health insurance as a premium, but the hospital is also covering a portion of that also, right?
Mm-hmm.
To get your retirement plan, like they have to put in money into the retirement plan. To get continuous medical education. Like I can go through the whole slew of things that a hospital gives you as part of its benefits. That
Right.
costs the hospital money,
Money.
right?
Yep.
But when you work as a locums, they ain't got to pay any of that stuff. They just
Right.
got to pay you to work. And when you come and work and then you get a check, you have to use your own money to purchase all those things that you would have gotten if you were an employee. So
Absolutely.
what I end up finding out is for me, when you boil it down apples to apples, what really I end up seeing the hospitals really saying is listen, as a locums, you are not predictable in terms of when you are going to work,
Mm-hmm.
right? That's how to me, I look at it. And we need predictability,
Mm-hmm.
right?
And that
Like
trumps everything.
that trumps everything. So you showing up on a month to month basis, like you could just bust out and be like, yo, I'm not coming in. And they can't do anything
Mm-hmm.
about it. And that's where they're very vulnerable. And I think that's the part that really drives hospitals nuts. They will say that the variable cost is variable cost of doing locums. That's
Mm-hmm.
expensive. I get all that. But I think
Yeah.
truly what it boils down to is, yo, I need someone to be on the schedule 6 months from now. And I don't have time for them to be like,
Yeah.
yo, I'm in
And
Cancun and
there's
I
a
can't do
very
anything about it.
easy fix to that, but I'm not going to get into that today. But the easy fix that I'm thinking about, if you've listened to our episodes in the past, is essentially what we did for this OB department, that we essentially staffed the entire call schedule. And I think I think it's as easy as that, but I won't get into that today. There was the other part of her question, Josephine's question, um, about the retirement. How do you plan for retirement, right? Because usually people think, oh, well, you get retirement through your job. And there are lots of different ways, to get retirement funds and save for retirement or invest for retirement without necessarily being employed. So, Nee, you're better at that, at those explanations than I am. So I'll let you bust that out
Give me the
because I got about
handoff,
5 minutes.
the track and field
Yeah.
handoff.
I got about
Boom.
5 minutes before I got to talk to my pre-med. So,
Yo, tell your pre-med to wait. They can wait. They're not in school yet.
well, they probably in college, Nee.
You know what I'm saying? Like they got
They
time.
got things to do
They got
too.
time. Tell them you recording. We
Okay.
got
They
time.
got things
Okay.
to
We trying
do.
to help. We trying to help the greater good.
Okay.
So, but okay, guys. So a retirement plan.
They are part of the greater good, though. So.
What you going?
Exactly.
It's the truth though, y'all. But like, so your company, you yourself as a locums doc, you need the benefit of a retirement plan. Like you have to have something that's going to help you put money away so that when you reach a certain age, you can use that money to go and live on a boat and go wherever you want to go when you don't want to work anymore, right? That's the retirement plan. So you as an independent contractor, you can purchase that. and you can purchase that through so many different places. But you basically purchase this benefit and you get access, in essence, to the ability to put money away. And when you put money away, that gets treated a certain way by the IRS, right? You get certain tax benefits to do that, right? It decreases the amount of taxes that the government can tax you on right now, right? So yeah, like there are, and then what that does in essence, it gives you a benefit, right? So we've done that in various ways. Like when I first started doing locums, 12 years ago, man, those numbers, the double digits now. Yeah, we getting up there. You getting up there, yo. So
Why does
yeah,
it always come to me?
because men age like a fine wine. You know what I'm saying? You ever notice that,
Really?
guy? You ever notice that, ladies? Like
In order
we
for that
just
to
get
be
better.
fine wine, you gotta
Huh?
stomp them grapes. So don't get stomped, me. Okay.
Wait, hold on. First of all, he said they age like fine wine. Let's just talk about the fact that he lost all his hair.
Okay. Thank you.
I am willing to say that I actually look better without hair than I did with hair.
You know what? I will not disagree because I've seen the
Yes.
pictures.
Yes.
But what I will say is that, sure, men up until a
Tiara's
certain
fired,
point,
guys.
y'all age. Okay. Well, good luck.
Exactly. Good luck.
Up until a certain point, though, men do age fairly well. And then there's, I don't know what it is, right around 50-ish, it's like, doop, fall right off the
No.
cliff.
No. So then explain y'all then, real quick. I know Renee has to go, but explain y'all. What happens after, what happens?
Look at this.
I don't know, because have you seen what 50 be looking like now for women? Have you seen what the grandmas be looking like now? Grandmas don't be looking like grandmas.
Exactly. Hurry up.
I'm not going to step into that. I'm not going to step into that. But I will say this, y'all. Like, yeah, a lot of this stuff, though, it seems like it's like, man, like I didn't sign up for this. Like I already got like all this stuff I got to work on as a doc, as a pre-med, or excuse me, as a resident, you know, or someone who's just coming right out. Like it's just too much. But you can do this. Like a lot of people are doing this, and yeah, there's a little bit of a learning curve. But when I first started, I just had like a regular like IRA, right? That's an individual retirement plan, or a SEP, right? Self-employed pension plan. Very simple. And we did that for several years. And then eventually we were like, look, like we do locums for a consistent period of time. We see ourselves 10 years from now doing it. So we upgraded our plan, which is an option, right? It's almost like how when we're looking for health insurance, like there's a gold, silver, and bronze, the same type of thing. We found something a bit more comprehensive, and then we transitioned into that. But y'all, that took several years, and then we finally got into it. We made mistakes, and you know, we that's how we do it now. And we have money, like we even have it to the point where we were able to take a 401k loan to help, you know, us purchase something, a big purchase, you know, over the last couple of years. All right. So like it's for us now, like we are at a mature level of ours. But I just want y'all to know, Josephine, that is an option that is available for you. And I highly encourage you, whether you put $50 away a month or however you want to put away, like you can do that. And that's the best part, I think, of locums is there's a certain level of independence that you get to practice that I think, you know, people love. You know, it's just like, yo, like, yeah.
Yeah, we're going to be, you know, this is a really appropriate question because we're going to be talking a little bit about this in our course, because that's one of the things. Yeah, just a little bit because we're not financial advisors, but we will be talking about retirement plans. We will be talking about health insurance plans. We'll be talking about, you know, how you get malpractice insurance. You know, all the things that potentially make people have a little bit of the heebie-jeebies about doing locums, right? These are the things that people worry about, right? About doing locums. How am I going to get my health insurance? How am I going to get malpractice? How am I going to get, you know, all these different things, retirement plans. So we'll be talking about this in our course. So if you haven't already signed up for notice about our course, I want you to go to the show notes And in the show notes, you're going to see a link for a freebie. Once you sign up for that freebie, you're going to be on the list so that when we are ready to announce that the course is accepting registrants, then you'll be notified. It's going to be limited seats. So if you're going to be interested in signing up for the course, make sure you do that as soon as we send out the notice. But that was a great question, Josephine. Thank you so much. And if anybody has any other questions, you can go to the show notes and you can either text us or you can do that. What's it called? Is there a link there down there that says tell us
Oh
what
yeah,
you
this
think or text us or
yeah, yeah,
whatever?
yeah. This fan mail. Just click on that
It's
link.
called the
We
fan mail
have
thing.
what we also have the form. We can add the form to that
Yeah.
to the show notes as
Yeah.
well.
So you can do that. You can DM us on Instagram. So just however you feel most comfortable,
Let
just
me
send
know
us
if,
a
guys, we
message.
want to
You can go to
know,
the website,
guys, we want to know what you think
boxoutsidethebox.com.
about GNX. Do you want me to do a future episode on a review on Kendrick Lamar's GNX? That's a question I want y'all to answer for me. Boom.
Why?
Well, before we deviate a little too far,
Yeah.
I know Renee has to go, so feel free to go handle your business.
Thank you.
I'm going to
Thank you.
circle knee back to
GNX.
not GNX.
Nobody cares.
No matter where you are in your career, you've seen patients your age or younger get seriously injured, have a long-term illness, or even have a mental health issue that affects their ability to work. Now, what if that was you? No, for real, what if that was you? Without disability insurance, how are you going to replace your paycheck? In episode 176, Jamie Fleischner of Set for Life Insurance explains why the best time to buy disability insurance is during your residency.
Most physicians acquire their disability policies during residency, and there's several reasons. First of all, when you're younger, you're able to obtain the insurance because they ask you a whole host of medical history. And so you usually don't get healthier over time. Usually you get less healthy over time. So when you're healthy, it's easier to acquire the coverage. Number two, it's also less expensive because it's based on your age and your health. You're not getting younger or healthier over time. So you're at the ideal time. The earlier you get it and the younger you are, the less expensive it's going to be.
So whether you're a resident or you're an attending, it's never too late to protect your income. Renee and I, we use Set for Life Insurance to find a disability policy that fit our needs and budget. So what are you waiting for? Check out setforlifeinsurance.com. Once again, that's setforlifeinsurance.com.
We were on the topic of retirement and insurance and locums, and we did have a comment a while back.
Okay.
And she was talking about how she does feel that there can be a conflict of interest from a hospital between a doctor and the hospital. Love Anani.
He was on the show previously with his wife.
Yes. He sent in the question where he said, I do think that there can be a conflict of interest from a hospital and a doctor. I don't think locums prevents that, though. In my department, protocols apply whether you are a part of the group or locums. Only difference is the hospital can fire the doctor directly versus firing the locum group or twisting their arm to get rid of the doc. So this was an older episode, and we'll link it in the show notes as well.
Yeah. All right. Bye, Dr. Renee. We'll see you later. Yeah. So that's a very interesting, precise type of situation. I'm glad Dr. Love brought that up without boring everybody. Like, there's multiple ways that you can be working for a hospital, and, depending on what specialty you are in, usually that dictates things. So for example, like ER doctors, normally what they do is they form a group, like they come together as a group, like 4 or 5, maybe 10, possibly 15. And then they form a company, right? So you'll have a company of ER docs, and then they have like a structure within them, like who's going to be negotiating contracts, who's going to be doing billing, all these different things. But they as a group will then go to a hospital or a bunch of hospitals and in essence, like sell their service as a group to a hospital or several hospitals, right? And then not only that, right? Like they, in essence, kind of run the hospital's ER department from within. So it's almost like
Okay.
there becomes like you become when you the ER docs that are part of the group, they are basically like employees of the group. But then the question is, are they also employees of the hospital? It could get real intricate and so forth, but there are some conflict of interest things that you may have to read up on, guys. But that's a very, like, it's a very unique issue that I think is mainly for things like ER docs and so forth. But those are for ER docs who are in a group that is negotiating with that same hospital that you're at. But if you as a locums ER doc is trying to go to any other regular hospital by yourself, you don't have to worry about that. So, because there is no conflict of interest. So, but that is a good
Right.
point, Dr. Love.
Okay.
Because I think Dr. Love, he's like I believe he's a medical director through a company that he works with that contracts their services to a hospital, I believe. So he may want to write in if he hears this and go from there.
Okay. And then I'm not really sure how to transition into it, but there was this topic on WorldStar about a doctor stating that doctors get paid more if they make the client sick.
Yo, I saw that. I saw that. Man, that's a tough one, right? So basically what he's saying is, I read the video and it's an old school doc. He's saying that, depending on what the diagnosis of the patient is, that's going to determine what the reimbursement rate is going to be, right? So he's given the example of, if you as a doctor see that a patient has a certain lab value that we all think is consistent with diabetes, we will give a diagnosis of diabetes, and hence we will get paid a certain amount from the insurance company. That is true, right? But that's how we base our ability to diagnose. These are guidelines. And yes, some of that stuff has to do with how insurance companies pay and so forth. The thing that
First of all, I want to talk about how not controversial, but concerning, I guess is what I'm looking for. How concerning it is for him to be on social media and saying that out loud. Like, could you imagine as a patient, you're scrolling, and this is what you come across, and he is your doctor, and you're like, well, damn.
Yeah.
When he told me that I had X, Y, and Z, is that even, like, did I really have that? Like, now you need, like, second and third opinions.
Yeah. And look, the way how I always describe it is like, yo, imagine going to your mechanic and the mechanic says like, yo, you come in to get your car evaluated just for like an oil change, right? You know what I'm saying? You go and then they say, well, your CV joint ×2 needs to be replaced. Like, what are you going to say? No. The most thing you will be able to say is, I can't afford to get it fixed. But how do you know?
What's funny is that actually happens a lot.
Right. How do you know it needs to be fixed? Right? Because you don't speak the lingo.
Does it happen to men? I know it happens to it. Like every time I go get my car, I got to get an air filter and I've got to get this and I've got to get that. But like, I wonder if it ever happens to men. Like when men go in for an oil change, do you guys actually just leave with an oil change?
I think most men leave with an oil change because it's not that we know more. I think we're just always more skeptical. And we're like, man, get the hell out of here. I ain't paying for all that. Right? Whereas they know how to craft, in general, they craft the story that they know will tug at women's emotions, which is, like you're let's say like you're driving and you lose control of X, Y, and Z. You don't want that to happen to you, do you? Or let's say you're picking up your kids and X, Y, and Z happens. And guys don't care about their kids, right? They're like, look, man, I'll be all right. Like, we'd be skidding the whole way and stuff, and we'll figure it out, right? All I'm saying is that they know there's certain psychology that they use differently to manipulate men versus women, but in essence, the same thing. And if you have a dude who don't know the lingo of what the mechanic is saying, he's going to say something to make you pay for it the same way, maybe a little bit differently that he'll say to you as a woman. You know what I'm saying? But it's the same outcome. But basically what I'm saying is the public doesn't know, like they don't understand. Like if they understood like how we diagnose and some of the things that we do, I think they'd be very shocked to find out about certain things. Like it's like you go to a restaurant, do you really want to know how your food is being made? But ultimately, I think if they knew how things were being made, they'd be like, oh, I get it. right? Like there's nothing really from a doctor standpoint. There's really nothing, on the, what's the best way I want to describe it? There's nothing, I can't see people being upset about the way that they're treated from the doctor standpoint. I think they'd be like, "Yo, I didn't know you had to deal with all this garbage as an insurance companies, you know?" And I think,
But I think the topic that he was trying to aim for was that between the doctor and the insurance and, either the hospital or the clinic, between the three of them or whatever, they essentially break their oath constantly, depending on what the illness may be. The severity of it, I guess.
some of that stuff I think was sensationalized. I think when I watched the video, I watched it and I was like, I think he's sensationalizing certain things. Like for example, if somebody comes into my hospital, right, and let's say they get into a motorcycle crash and they break their arm, they get a head injury and they break ribs. Like and then let's say they're also diabetic, right? If I'm treating all of those different things, I'm going to list all of those different things that I'm treating. And that's going to increase the level of reimbursement that I get, right? So yes, I am getting reimbursed more, but that's because I'm treating more stuff, right? And the question though is, do I have sinister intentions by doing that, right? Do I have sinister intentions by doing it? And I think most people listening would be like, no, like if you're taking care of somebody who has all of these issues going on, there should be a potential that you should get reimbursed for taking care of all of these different things.
Well, what about on a smaller scale, though? On a smaller scale, you're a trauma surgeon, so everything you do it's on a larger scale.
Mm-hmm.
So let's take it back a little bit. Let's think. So I see an allergist, right? I see an allergist regularly for the multitude of allergies I've developed as an adult. And I find it redundant for me to go in just for him to check on me. Hey, how's your breathing? How are you doing?
Mm-hmm.
I think that's redundant.
Yeah.
I always get charged a lot more for that. So I cancel those appointments. He's like, oh, I want to see you in 6 months. I just don't schedule them. But then it comes to a point where he will stop me from getting my shots until I see him.
Yes. So part of that is due diligence. We need to see how you're doing, how you're reacting to the medications, right? That happened to my mom once, right? Like my mom was getting her high blood pressure medications. And then all of a sudden she called me and she was completely pissed off. She was like, yeah, they won't let me get any more of my high blood pressure medications. I called the doctor and the doctor says, yeah, we've been trying to schedule follow-ups with your mother for over a year. So I don't know how she's doing. I can't check her blood pressure when she comes in. How do I know that the medications is even working? So there's that component also, right? Which is, I just need to make sure you, Kiara, are responding very well to the medications that I am doing, right? It may sound redundant, but yeah, part of that is just doing the due diligence of making sure that you're doing well and that you have a good reaction with the medications, right? Now, the question that you are having, like, are all the questions necessary? Are all the questions that they're asking you actually necessary, correct?
Yes.
Right. So that's part of the general intake that they do in order to make sure that they can bill the correct way for you. So yes, there's that component also, right? Part of you coming in to see them is, how's your breathing doing? How's your heart doing? Any complaints, any fevers, any chills? All of those different questions they document so that when you go...
I'm very much on the, if there's something wrong with me, I will let you know. I will come to you and let you know. But I see your point. I see your point.
Right. Because what if every time you take the medication, you get like a bad reaction? It's just that like, you're not telling me, right? There's that component. And I think I can't cape for every doc that's out there. Like there are docs who like skirt the business, right? There are docs who figure out how to make this work in their in favor of them. I don't know what everybody does and stuff, but I'm sure that there's some people who do manipulation, right? That's the reason why some doctors get sued by the government or by Medicare and so forth. That occurs. I would say the majority of them don't do that. Majority don't.
Okay. Well, I mean, that's
but that was when I saw that. When I saw that, I was very interested. But then the other thing too is like the majority of docs now are employed, right? Like so, like we don't get paid like that anymore, right? Like what he's talking about is like people who do private practice, which for the most part, if you're listening to this right now, if like the minority of doctors right now in the United States are in private practice, right? Which means that when you're working for a hospital, you know who does the billing? The hospital, right? Like they do it based off of what you write down and what you document. And then that money doesn't come directly to you as a doc. That money goes to the hospital. And then the hospital takes whatever they get and they divvy it to the doctor, right? So it's a little bit, or actually it's very different now. The incentives to do all those different things that he's talking about, I think for the most part are gone, right? Because now you've just entered somebody else, a big middleman or middle woman into the picture.
I get it.
Yeah. You really got to be doing it for the love. You really got to be in medicine for the love of medicine. That's what I'm saying.
He does seem a little older, so maybe his viewpoints are a little antiquated.
Yeah, I think so.
All right. And then we did have a listener shout out.
Okay, let's hear that because we like to hear good news. We love to hear good news.
It's from Vladimir Hilaire. Sorry if I mispronounced it.
That is a Haitian.
Says hello. Not sure why everything. I'm sorry.
That's a Haitian. I think that person is Haitian. Hilaire.
Oh, so this might have been for
Renee.
Yeah.
I doubt it though. Most people don't write in for Renee.
Are you sure about that?
He said he's not sure why everything came in all caps, but he says, I'm a listener of your podcast. It was instrumental in my deciding to pursue medicine as a 30-plus-year-old non-traditional.
What? Really?
Yeah. Mm-hmm.
Okay.
He wanted to thank you and let you know that he's been accepted to their top choice school, and he really appreciates the podcast.
Oh, okay. What's his name? Vladimir? Vladimir. Yo, congratulations, man. That's a big deal. I think it's a big deal in the United States to go to medical school when you're in your 30s because, it's just like more than likely you've changed your career from something else. And then not only have you changed your career from something else, you also like change your financial situation because you're going to have to take out a lot of debt, right, to pay for going to school. And, now you're going to school in your 30s and there's just like that little bit less amount of time that you have to catch up with everybody else who went to school in their 20s. It's minor. It's a minor change and so forth, but it could be very scary. It could be very daunting. But shout out to you, Vladimir. Like that's a big, big deal. I think in my class in med school, the oldest that we had was someone in their 50s, right? And I think they're still practicing now, right? Because I graduated in 2006. Oh my God. Damn. So it's about to be 22 years. Next year is about to be 20 years. So they're in their 70s right now. They're in their 70s. Right? I'm right? Alfred, bleep out my age from that. Right? And so that means, so like that should just tell you something, right? Like I've been out for 20 years. 19 years. So like this person is in their 70s practicing. So it's a big deal when you are changing careers. So shout out to them. Man. Yeah, that's a big deal. Have you guys ever thought of because like when I was in college, I knew that like when I finished college, the goal for me was to get into medical school. Whereas with my friends who were engineers or they were marketing or whatever, like for them, it's get a good job. Right. So then once I got into medical school, then it's the next 4 to almost 10 years of my life are already predetermined. Right. It's not really working. It's just in school. Mm-hmm. Right. Whereas if you are not in medical school or you're not in law school, it's you climbing up the ladder, you're developing experience. In those 10 years that you work versus that I'm in school, you could shift to different businesses or shift to different companies. But then there's a point where I remember like in their mid 20s to late 20s, my friends were changing jobs or changing professions. And I just didn't understand that. right? Because I'm in the midst of finishing med school or going into residency. And then it's funny, like now that when I finished residency or fellowship, I started doing locums. And then I had a major shift and, now I'm doing locums. I feel like everything that I've done is like 5 years to 10 years behind my friends. My friends are like ahead of the game because they didn't have to do the whole school thing continuously. Did y'all have to do any of that? Like, did you guys ever have to shift gears like that? Audrey, you too young, maybe.
Well, I was in the military, so yeah.
No, straight out of high school, straight into campus engineering. There was no shift or change. Yeah.
Audrey, what kind of engineering did you study?
I studied biosystems engineering.
Say that again?
I did study biosystems engineering. I don't know if you can hear me.
Biosystems,
Biosystems,
okay.
yeah. It's more of like mechanical systems combined with, like, you integrate mechanical systems into civil engineering and then also into like electrical. So a combination of the three.
So there's a lot with this.
So Audrey's like smart.
Yeah, so that's thermodynamics, right?
Yeah. Fluid mechanics.
And then that's materials.
Material science. Mm-hmm.
Yo, okay, so if y'all don't, Audrey's the type of people that I went to school with, and yeah, so you had to know chemistry on a whole different level. Oh my goodness, yeah.
Physics.
So you did PChem and all that, or?
Yeah, physics, chemistry, mathematics, all that.
The whole time we're sitting on a genius right here. Wow. Okay.
Yeah.
Do you get to use that degree? Are you using that degree much? Like, tell us about like the trajectory of like what happened after high school and so forth.
So after high school, I got into school, like engineering. I studied it was supposed to be a 5-year program. So like a 5-year program without any breaks. But then COVID happened and 1 year went down the drain because you're just home, studying. You can't study online. It's math. The lecturer in class is struggling to make you understand. So there's no way you can understand online whatever he's teaching. So 1 year down the drain. So it took 6 years, graduated. I kind of changed trajectory. I don't practice engineering currently because, here we are. So I decided to just do freelance work and, be a virtual assistant. And I think it's also part of the contribution is the country I'm in. Because you have to start, climbing the ladder. Like, you have to start, with a salary of about $150 or $200 max, and climb the ladder throughout the years and hope for the best that you'd get a promotion or something. So I was like, nah, this can't work. So I changed trajectory. I was saying no initially, but then I realized, I did change my trajectory. Life happens.
I appreciate that perspective because that's a perspective that, we don't really get to consider, which is, okay, like there's a certain predetermined state that you're in. And the question is do you want to do what everybody else is doing? In essence, you're non-traditional.
Yeah.
And you go the complete other way and stuff. So, yeah.
Yeah.
Yeah, I appreciate that. Kiara? You went from a
I changed multiple times.
How do you guys describe it? You'd be a non-civilian to a civilian or something, or
a service member to a civilian.
Okay.
But before that, I actually had a scholarship to school and I dropped out.
Okay.
I was initially I actually dropped out twice. I wanted to be a lawyer first. I stopped once it got too political and I was just like, And then I got a scholarship, full ride to UMass Dartmouth. I went for psychology and then I dropped out, and that's when I joined the military. I worked with, I was aircraft administration while I was in the Marine Corps. Once I finished that up, I worked at a daycare, just because. And then I went to school, graduated with a bachelor's in marketing and management. And I guess essentially that's what I do now, right?
Yeah.
So I guess it kind of worked out. And then I'm about to switch gears again and start working for a certification for data analyst, which kind of all ties in anyway. So I guess that's my trajectory.
Let me ask you a question before we get out of here. Let me ask you, because I heard you say something
Okay.
about working in a daycare. You didn't like that. And like, what's the worst job you guys ever worked?
All right. Well, first of all, the daycare, I was not in daycare. I do not watch other people's children. I want to make that very clear. I was the front desk receptionist.
Which is the worst
I
job,
was the
actually,
front
because you
desk.
got parents who are like, I want to know what's going on with my kids.
Yes. I did not last very long there. I was like maybe 6 months and I was just like, yeah, I can't do it.
Mm-hmm.
My worst job, I want to say it's either that one or retail. I did retail before, like as a teen. Just people are just nasty.
Yeah. Yeah. I heard that. Audrey, what's the worst one? And if you say this one, yo.
The worst.
Yeah.
The worst job I've ever done is customer service, like answering like phone calls and emails and texts. People are rude, and I don't think people realize that I am not the problem. It's the company I work for that's the problem. So
Yeah.
you yelling at me or speaking to me in a not so nice way has nothing to do with me. I'm just the person on the other side of the phone, and the error did not come from my end. So yeah.
Mm-hmm.
It was just the longest shift, the longest days. I just couldn't. I stayed for a year, quit.
And that was
A
it.
year is a long time.
You put up with a lot.
Mm-hmm. It also alters your mental state. The one thing I realized after the entire year, I realized my mental was really tanking. It was bad.
Really?
Yeah.
Oh, so you were taking the complaints personal then?
No, people speak to you like you're the one who did the wrongdoing. For example, they were billed wrongly. So instead of just speaking to you in a nice way, asking you, for example, if you could make the correction and all that, they're yelling, they're calling you names, they're cursing. It was just too much. After a while, and then you always have to be the customer is always right. The notion of the customer is always right. So you're on the receiving end of the not so good things, and then you have to change direction and try to calm them down. And yeah, it was just too much.
You know, now that Audrey says that, because in customer service, it is the customer is always right. Is that the case as a doctor?
It sure feels like that at times. I'll tell you my perspective. My perspective is, no, the customer is not always right. Right. I'm very clear with patients, particularly patients who are disgruntled about certain things. I just say, listen, consider me like I'm your coach, or consider me like we are collaborating together on your health. Right. I do not I work for you in this fashion of I'm advocating for you. I'm helping you get to a certain level of steadiness, but I'm not a worker for you who is subservient. I'm always very clear with that. And I think the way how we are in today's world with customer service, there's always this, you work for me. And I'm telling you that I want to do X, Y, and Z. And sometimes you may get it with I want pain medications and, this, you work for me. And it's well, no, I have to help. I can't just, blindly give you pain medication. I'm just using that as a one small little example snippet. I have to look at overall how you're doing and see, one, yes, are you having pain? Do you have signs of that? It's subjective and so forth. But there's many different ways that I can give you pain medications, or I can allay pain without necessarily giving, exactly what you want in terms of the type of pain medications, right? There has to be a side effect profile that I have to consider and all that stuff. But the way that I'm very clear with patients is that, look, I work with you. I don't work for you. I'm advocating for you. I will make sure that, you get the best care and you get my best. But this is something that me and you are working on together, but I definitely I've seen it more and more that people or patients or people who are very disgruntled, they come in with the same thought process of regular business and the customer's always right to, what's happening in medicine. Is well, but if you don't understand your diagnosis, or if you don't understand what's going on, how can you say that you're right? I can understand your complaint and I can say that I hear you, But sometimes your perception is definitely not your reality, particularly in medicine.
That's fair.
Yeah.
That's fair.
So,
because everybody's a doctor now. You got
oh
Google,
my
you got
goodness.
WebMD, you got Wikipedia.
What? It's crazy. I mean, to some extent, it makes things better now because there's a lot, like, I'm that old ass doctor who was on World Star, like during his heyday, like it was very paternalistic. I tell you this and you do it and stuff. And at least now, like, people have knowledge. So you have to really be on the up and up, and you have to make sure that you are explaining things in a way that, helps them feel like they're part of the team, right? Like they have to understand, like you can't just say your CV joint is broken and that's it. Like you got to say, listen, like you need this surgery for your appendix because of X, Y, and Z. And this is what I'm going to do. And here's pictures of what I'm going to do. And this is how you are going to get through. Like Renee was right on that last episode where she said like the 99% is the same, but that 0.1% makes a big difference. She explained it way better than me. Right. And it's true. Like we all practice the same way, but like my ability to kind of sit next to you and hold your hand while I'm explaining things to you, or show you pictures of what the surgery will look like or what your diagnosis will look like, or, kind of physically, take you through the process of where we're going to be over the next 3 months with your disease. That means a lot. And you can't measure that sometimes. So that's where for me, I really hope that I excel because I learned that message from my mom. She was a nurse's aide or a nurse's assistant. So her job is a very, very tough job. If anybody understands what that is, it's not very glamorous. It's a lot of, it's tough. So I've always kind of like think about my mom when I'm in these jobs. Like, what would my mom think of? What would my mom say and stuff? Because she would oftentimes say like the doctors, sometimes could be, she would talk about the doctors that were very nice to her. She would talk about the doctors that were very rude to her. And, as a young boy, you're like, man, when I get a chance, I'm gonna get them doctors that were really rude to her and stuff. But I think it's very important. Like when I was in training, and this would be my last point, when I was in training, I got to give a shout out and also a rest in peace to Dr. Weaver, who is the chairperson of our department. And I remember the first thing he said to us is, you will treat everybody the same. You will say good morning to everybody the same way. You'll say good morning to me the same way you'll say good morning to the housekeeper. And, that stuck with me forever, right? Because whenever I see the housekeeper or if I see, some of the aides or the nurses' aides, I always think about like, what if it was my mom, right? So I always say, good morning, miss, good morning, dad. I never say their first names, right? Because most of them were all older than me and so forth. But there's a certain level of respect that I've always had with patients and, trying to make sure that they understand that, this is a collaboration, not just me telling people what to do and stuff. So, on that note, I'm going to leave it at that.
All right. Well, let's wrap it up.
Kiara, you got to schedule us to do a review of GNX Kendrick Lamar. When are we going to do that?
GNX Kendrick Lamar. Let me look.
I'm just teasing. We'll do that another time, but we'll weave that in. But guys, get that album. That album is amazing. Amazing album. Audrey, did they have you? Have you listened to it yet? Oh, you on mute. I may not want to hear what she said.
I said no. I'm gonna try and listen to it on Spotify.
Ooh, it's amazing. It's amazing.
Okay.
It's a great album. All right, y'all. We are going to end this. Remember, guys, you can you can reach us so many different ways. Instagram, you can reach us through email, the links below, and even on YouTube. If you leave a comment below, we'll read those and we'll comment on those on a future episode. All right. Catch you guys on the next one, y'all. Peace.
Bye.